So this is just answering questions about the food allergy component in the canine dermatology series. Clients are often very reluctant to do a food trial. Some of my tips on how I can get them to do that. One of the things that clients always say to me is, well, I don't think it's a food allergy because my dog has always been fed this food and there's been no problem. Now, my attitude towards food allergies, I either see it in very young dogs or I can see it in dogs 7, 8. So if you suddenly see a dog developing an allergy or an itchy pruritic skin disease that isn't ectoparasites, I'm not thinking of atopy because I think of that happening between 1 and 3. So an 8-year-old dog, I'm saying to the client, well, this is something that we can really see in dogs with food allergy. Certainly if they've got any sort of gastrointestinal signs, then it really pushes me to really push it even further. But I say to people, look, I know this food is expensive that I might be putting you on, but I'm doing it for a 2-month period. That will usually be as long as I'll do it, sometimes for 3 months. So encourage them to do it that way. I say the dog isn't allergic to the type of dog food you're feeding, it's allergic to the individual ingredients. So it's allergic to chicken or to rice or to beef or to lamb or whatever. So I think perhaps because they're coming to the referral, they're desperate to get the problem sorted out. I've got an hour to spend with them. I kind of really spend time on bullying them into doing it, basically. So bullying sometimes will work. You're asking them to do it for a period and saying, look, this is a diagnosis which, whilst rare, we might miss. I only think about 5% of my cases are food allergic. But if I don't test them, 5 to 10%, then obviously I'm going to miss those ones that are food allergic. So I just think it's very important to do, and I obviously really emphasise that to the client. If an owner can't afford a prescription diet, what is the best commercial diet, aside from cooking fresh? I think James Wellbeloved is a good diet. I mean, people use that quite commonly. The problem with a lot of these commercial diets is, turkey and rice. Turkey, I think, is quite a novel protein source. Rice, possibly less so. But certainly, it's a diet that you can try. And one of the things I always ask people to look out for is if the dog becomes worse on the diet, that can also be a sign. So those commercial diets are a little bit cheaper. When you say fish and potato, do you mean white fish or tuna? I tend to go with white fish. Tuna and salmon has more histamine in it, so there's more likelihood of a reaction. And certainly dogs could have a food intolerance to something with a high histamine level. So I would tend to go for a white fish, and I tend to go for haddock or coley or something like that. Cod, of course, was becoming quite rare fairly recently, so I took that off my list because I didn't want to be just causing more of an environmental problem with that. Royal Canin hypoallergenic versus Hill ZD. My feeling is that one of the reasons I love Royal Canin is it's very palatable, but certainly, it's good to have a choice of diet. So if one of them is not working so well, if the dog isn't eating it or whatever, then you could certainly change over to the other one. But my experience is, and the reason I have Royal Canin as the first line is because I find that quite palatable. Do you think blood testing for food allergies is reliable? Absolutely not. I think I made that quite clear in the webinar. Obviously with time it may get better, but as it stands at the moment, I don't think it's a test that we should use, and it's not one that I do use. What criteria for the end of the food trial period? I think if you are 2 to 3 months in and the dog really hasn't improved, then it probably is not going to. Quite commonly those dogs with food allergy will improve within the first 4 weeks, but they can take longer, which is why we prolong it. But often at 4 weeks, if there isn't really a significant improvement in the dog, I will be looking to do allergy testing for atopy, so skin testing and blood testing. And I think, do you supplement your homemade fish and potato diet? I think for a 2 month, 3 month period, I don't do that. I don't think it's necessary. So from my perspective, I'm happy to do that, and I haven't felt that I've come across any problems with that technique. Right, so that other question I've answered. I would say to blood test at 4 weeks for A to P if there really isn't any improvement, and I tend to use the Heska test, which is marketed by IDEXX. So I think that's all the food allergy answered. So look out for the next webinar the next video when we will be going over, let me see, there's some miscellaneous questions. So perhaps we'll do the miscellaneous next. Thanks very much. Bye bye.